On September 9th, President Biden announced the implementation of a multi-pronged, broad-based national strategy to combat COVID-19 in the U.S. This strategy includes new rules that will impact most employers. As part of Biden's plan, he has directed the Occupational Safety and Health Administration, OSHA, to design and issue a regulation requiring employees with 100 or more employees to ensure their staff is vaccinated against the COVID-19 virus, or to have all unvaccinated employees tested weekly for infection. OSHA has also been directed to develop and issue a rule requiring employees with 100 or more employees to provide paid time off for workers to obtain a vaccine or to recover from any vaccine-related reactions. If you are under 100 employees, some states, like Oklahoma, allows employers to make vaccinations mandatory. Every employer will want tools to track this information. CS3 has designed a COVID Response Center package for both Scissortail HCM and for Sage HRMS software. Now's the time to prepare for these reporting requirements that will be coming from OSHA shortly. I've asked Rhonda to join us today to share how the COVID Response Center works. Today, she will be demonstrating with the Scissortail version.
I've logged in as Kathy Watts, the Director of Payroll and HR for our sample company. Kathy's in and can see all of the different dashboards across the top of her screen. We've added a COVID Response Hub, and when she clicks that, she'll see a few different charts as well as the report that makes up those charts. This first chart is the COVID vaccine tracker. This is giving us a status of all of the employees that work for the entire organization. Each piece of the pie, when you hover over it, gives you a count of employees for the different vaccine status. We're looking at one that says COVID vaccine complete with 4 employees. The next chart is a COVID vaccine by division. Each column makes up the different divisions in our organization, and the colors on each column tell us that we have employees in those status within that division. The status that we already have set up in the system are COVID booster, COVID vaccine complete, first dose, people with a health exemption, people who have refused a vaccine, people with a religious exemption, people with COVID vaccine unknown, and people with COVID training. The COVID training is an option to take the training in lieu of taking a vaccine. Each of the statuses can be customized for your organization. The report below is actually a report that makes up the information in the charts above. This can be accessed by clicking the blue words on any of these screens or any of the widgets. When we get to the report, you can see there's a vaccine status column in the center of the page. Let's say we want to communicate with the people who do not have or are unknown as to what the status of their vaccine is. Let's filter for that. Now we've got 4 people that have an unknown vaccine status. By clicking the check mark in the black box, we can select all of those employees. Now I can click the Communicate button and pull up a template that we've created for the COVID messaging. This ensures that we have a consistent message going out to all of our employees. This template says that the company has implemented a COVID vaccine tracking system, and as a result, you have the ability to complete an employee vaccination status form inside Scissortail. Another item that we can do as part of this communication is we can determine to send this as of a later time frame. So you could set it all up and send it tomorrow or Monday or whatever day that we're kicking this process off. Now, let's pretend we've sent out this status. The next thing that we need to do is we need to make sure that checklist is ready for those employees when they log in. The next step is that Kathy's going to do is she's going to click on the hamburger. She's going to go to checklists. She can just type checklists at the top and then look for the one that says HR and checklists in the breadcrumbs. When you click this, you get an at-a-glance view of all of the checklists that are currently assigned in your system. Let's assign the vaccine status checklist to our employees. So we had 4 employees that we want to assign this to. I'm going to make sure I have all of them on my screen so I can find them. Josh Bronson was 1, Dana Fry, Paul Peterson, and Kathy Watts. I'm going to add them to my selection and I'm going to click apply. Now I just need to choose my checklist and click save. Now you can see that I have a list of 4 people who've had the vaccine status response checklist added to their account. Next, let's log in as Josh Bronson and walk through completing that checklist. And I'm on his home screen. We immediately see that there's a red dot in our to-do bell. So let's click that to-do bell and follow the dots to our checklists to find our vaccine response checklist. Click Go to Checklist and then follow the links to get to our vaccine status response. You can see the questionnaire on the left side of the screen and the responses or places for us to respond on the right. As Josh, has he had COVID? No. Has he been vaccinated for COVID? Let's say yes. His manufacturer? When did he get his first dose? When did he get his second? Has he received a booster? And since there is not a red asterisk next to the date of his booster, this next field is not required. We'll ask him to sign using his password, and when we scroll up, we can save to stay on the page or leave the page and come back. But if Josh clicks submit, it will actually notify HR that he's completed this form and it's ready for their processing. We're back as Kathy Watts, and Kathy has received notification that Josh Bronson has completed his vaccine response form, and now she knows that she's ready to update his record. Let's pull up Josh. COVID response vaccine status. On this screen, she's put all of the different widgets that she's going to need to complete his information. Previously, we had Josh set up as a COVID vaccine unknown. Now that he's responded, we can delete that COVID vaccine status. Kathy's going to click Add to add his new status, which is a vaccine complete status. Check the box and click Apply. Some of the other things on this screen are the checklists so that we can see that he has a COVID status checklist. We could come to the credentials area and we could add credentials such as uploading a copy of his vaccination card. We could look at any employee documents that might be associated, or we could look at any of his forms that might be associated with this as well. So that's all there is to updating the COVID status for an employee. Taking a look at the COVID Response Hub one more time. I think it's a pretty neat tool, and I hope you will too.
Rhonda, thanks for showing us what the COVID Response Center looks like with Scissortail. That leaves us with 2 questions. How much does it cost, and how long will it take to get your response center implemented? If you are a Scissortail HCM client, you will have a one-time fee of $500 and a slight increase of $50 in your annual subscription. Once we begin your implementation, it will only take a couple of days. If you are on Sage HRMS and also on a CS3 Serve plan, you will have a one-time fee of $2,000 and a $50 increase in your Serve plan. If you are Sage HRMS, but not yet on a CS3 Serve plan, you will have an initial fee of $3,000, and you may incur additional fees as Sage or the government makes reporting changes to COVID. For Sage, once we begin your implementation, it will take about a week. You may contact your Client Account Manager, IRA Apt, for more information to initiate your project and to also answer questions about a CS3 Serve Access Plan. Thank you.